Ever open a med search chapter, see all the bolded terms and feel lost before reading the first line? I've been there. Hi friends, I'm Nurse Mia and welcome back to the GetZen RN study group. This part 1 of the chapter, Key Terms Made Simple. It's exactly why we start here, because those terms make the rest of the chapter finally make sense. Key terms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Those words are the foundation. Without them, you'll read the whole chapter as a guesswork. Most chapters start with 10, 40 terms, and each one connects at least one clinical pathway: lab, symptoms, nursing intervention, diagnostics. These are just test words. They show up in NCLEX terms, in nursing reports, and real patient conversation. Imagine your patient says, "Nurse, the doctor said my atrial fibrillation is causing hypertension and it might be from polypharmacy. What does that mean?" You will need a language not just to understand it, but to explain it with confidence. Let's break it down term by term, Q by Q, calm and clear. Let's get started. This chapter is very short in key terms. So, chapter 17, priorities for post-operative patient, the terminology. As you see here, we have like a couple of them. That's 8. So here you can see how we do. So the first is anesthesia. We've been talking about this for the past 2 chapters. It's a medical treatment that prevents pain during surgery, often causing unconsciousness for general and localized numbness, regional, local, or sedation. So we've been talking in chapter 15 and 16 for the intra-operative. And here I give an example. General anesthesia, it's used in abdominal surgery. Local anesthesia might be used for dental procedures. So here you can see how I have all organized my key words in case you need it or want it. The second keyword is hand off. So means a structured communication process during patient transfer between providers or units to ensure continuity and safety. So hand off. So the PACU nurse uses S-bar to give a detailed handoff to surgical unit nurse. Patient-controlled analgesia, PCA. The registered nurses students will learn in skill lab about this. A method of pain management, allowing the patient to self-administer a present dose of analgesic, typical via IV pump. So a post-op patient uses a PCA pump with morphine to manage pain without waiting for the nurse. And it's kind of a clock and has a special key and everything. You learn more in the skill lab. It's a fun topic. Phase 1. So this is the chapter post-operative patient care starts with the phases. So here the definition of phase 1 is the initial phase of post-operative recovery in the PACU, focused on close monitoring of vital signs, airway, and consciousness. So the patient remains in PACU 1 until fully awake, stable, and can maintain their own airway. The phase 2 is the intermediate recovery phase, preparing the patient for discharge to home or transfer to a hospital room. So in phase 2, patients are alert, stable, may begin oral intake and ambulation. Oral intake is liquids, clear liquids. Phase 3, the extended care phase for the patient, requiring continued observation or care before discharge from the facility. A patient recovering slowly from anesthesia may stay in phase 3 until fully stable. The post-anesthesia care unit, PACU, it's a specialized unit where patients recover immediately after surgery under close observation. So this unit, the nurses in this unit will monitor the patient airway, vitals, pain, surgical site for complication. And the last one is sedation. So the administration of drugs to produce calmness, sleepiness, or reduce awareness, often used with minor procedure. A patient undergoing a colonoscopy may receive a moderate sedation to stay relaxed but unconscious. But here, this person will need a driver, for instance, to to be transferred at home. Cannot drive because he's conscious, but is not fully. And this is the end of the chapter. Thank you, and let's see you in the outline. Bye for now. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.